Munyosani. I am come from Mauritius. Après que je fin connais, que je fin un esophagus, je plaisir docteur dans Maurice. Personne ne fin connaît, m'a pour faire l'opération. On fin conseil, moi fin jamais on ça aller à l'en, this l'en même pour faire ça.
My name is Riyad Juman. So he's my father-in-law. He has been diagnosed with esophagus cancer about 2 weeks ago in Mauritius. So he was really shocked, and in Mauritius they said that they didn't have the proper equipment to perform the surgery, and he was advised by the doctor to go to India, to more specifically Chennai at that time, and they connected him with some people in Chennai. So we did some research. I have some friends from Delhi and all over in a few places in India. They all mentioned, Delhi is the right place to go. We approached different hospitals. So when my friend suggested, Medanta, and we did some research on it and on the internet, and we were quite happy to learn about Medanta. We spoke with. We got an appointment with Dr. Perwaiz, and he took his time and he spoke with us over almost 30 minutes on the phone. He actually looked at all the documents that were sent, and on the phone his attitude, his behavior, and the way he approached the entire matter was the deciding factor. It was right there and then that we decided to come to Medanta, and Dr. Azhar Perwaiz would be the doctor performing.
Hi, I am Dr. Azhar Perwaiz. I am a Director Esophagogastric Surgery at Medanta, the Medicity. Today I am sharing my experience with Mr. Fazal, who is a resident of Mauritius. He presented with difficulty in swallowing food. So that was the best thing, that the patient recognized that it is a problem, so they got some endoscopies which proved that he has got esophageal cancer. After that he came to us at Medanta, Gurgaon, where we did a PET CT scan and some blood test which showed that he has got a disease in the lower part of esophagus, which was a cancer, and luckily it was an early disease. So we had various options in that situation, whether to go for chemotherapy, radiotherapy followed by surgery, or to go for surgery. So what we have to choose has to be in the best interest of the patient's long-term outcome. In that situation, since the disease was early, I opted for upfront surgery. Patient's concern were anxiety and stress, and the question was glooming in his eyes that whether he will live. So what I assured through my team approach, that if we timely intervene, timely diagnose and timely treat, we can take care of the problem, whether or whatever the disease is. So we got blood tests and we assessed his fitness, and since the disease was early, we chose to take him for upfront surgery. During surgery, since he had a previous surgery when he was of 18 years of age, had a midline scar, surgery was little challenging. There were a lot of adhesions, but luckily we could able to take care of his disease, where we removed the part of the esophagus through a small abdominal scar through the same old scar, and after removing the esophagus we take the stomach as a new food pipe which is through the inside of chest and brought into the left neck. Surgery took about 4 hours. After surgery he recovered uneventfully. In day 7 he is planning to go home. He is happy. The most important promise which was fulfilled, possibly his fear that yes, he had got a chance to live, and he is eating which he was not before.
The moment we came at Medanta, everything just fell into its place. From the very first day, the international patient service, wonderful people. The hospital pick us up from the hotel, bring us here. It was straight, quick service. We didn't have to wait a long time. And we met with Dr. Perwaiz. He was also very supportive, very confident. He knew exactly what he was doing, and we never had any doubt about anything. Surgery was performed. The patient was there. We actually got to meet the entire crew in the hospital. They were extremely receptive, hospitable, and very helpful. Most specifically, their nurses working. What I can remember is Preeti, Kamna, and Miss Joy, and extremely helpful. Every time we needed them, they were here, and I would definitely recommend Medanta to Josephat.
So what generally we feel that there is an integrated approach, not from the doctor's team alone. It is the patient's awareness. The attendants believe that as a team, with the doctors, with the patient support, and the attendants to support as a social support, we can achieve great quality of life even after surgery. Patient can eat, can have a normal life, and what I feel that if we treat this way in the integrated manner, we can provide very good quality of life to the patient and long-term survival. Thank you.